Dr. LeBlanc, I would like to talk to you about dentures, and actually about a specific type of dentures. There are about 30 million people out there in the United States of the USA who have apparently an implant. Who have a denture. Now, people always complain about dentures getting loose, and they kind of blame the denture when it really is the bone losing structure. So it's like losing weight, so that the trouser was the same, but you lost weight. For us, most of the time it's the other way around. But now there is this new thing, I call it a hybrid, where denture implant-supported dentures. You put a couple implants on it, and the denture becomes day and night compared to a normal denture in terms of eating. Shed some light on that, of what's going on there, and the phenomenal fusion of implant and denture which can be happening.
Right. Well, fortunately, you mentioned 30 million. I think that number decreases as the years go by. There's much fewer denture wearers today than there was 23 years ago by a large number. Because as we've discussed before, the best way to replace a tooth is not to lose the tooth, and that's with prevention. But let's say we do have somebody, and with whatever caused them to lose their teeth, now they're faced with wearing a denture. An upper denture, and the denture wearers that are listening to this will all be nodding their heads. Upper dentures are pretty good. People get along with them fairly well. Lower dentures are miserable.
Except they cannot taste their coffee and their steak.
I'm not saying it's ideal.
And they're so Béarnaise anymore because their palates are covered with one plastic or metal.
Yeah, no question. Ideally, no dentures are the better way to go. But with lower dentures especially, most prosthodontists nowadays, they won't even discuss making a lower denture without implants, because they know with some implants they can make a lower denture that the patient's going to be really comfortable with. Whereas with even the best prosthodontist with the best lab in the country knows that he can only make a lower denture that's better than nothing. Whereas with the implants, they know that they can make a lower denture that the patient's really going to be happy with. So there's been a tremendous improvement with the quality of denture wearers' wives with the implants. No question about that.
So it's a good way to go. And it's definitely a lot cheaper than getting a whole round house of implants.
And Helmut, aside from expense, when people have a denture, especially a lower denture, it's because they've lost teeth. I mentioned this to you before, but most tooth loss nowadays, especially when it's all the teeth, is from periodontal or gum disease. Periodontal disease eats the bone away around the tooth slowly. So by the time these patients have lost their teeth, they have very little bone left. Their jawbone literally is half of what it used to be. So now with putting implants in, sometimes you can only put implants in certain areas because there's not enough bone left. So they don't have the option of getting implants everywhere, especially further towards the back. So with even, let's say, 4 implants to stabilize and hold in a lower denture, it is a night and day difference over a denture without implants.
So a denture with implants, especially for the people who out there who have now one which has no implants, and they may be able to put the implants in on the old dentures. They might not. It's a matter of in how good shape it is, I guess. The denture I'm talking about. But tell me, in terms of eating, can a person with an implant-supported denture, the hybrid denture as I call it, can they bite into an apple? Can they chew on a spare rib?
Why didn't I know you were going to bite into an apple with that one? Some people can, yes. It's always dependent on the situation. I would never promise any denture wearer that they can bite into an apple. That's a very difficult thing for someone to do with perfect teeth. But some people can. I mean, it makes that big of a difference, yes.
And just the feeling, I guess, of that denture might never come out when you kind of eat normal food and when you speak normally, but that feeling, that small, wiggle going on, must make a difference of confidence like there's no tomorrow.
It's all about confidence. When most everybody that goes from a standard denture to a denture that's implant supported, they will always say, why didn't I do this earlier? You know, why did I wait so long to do this? Well, the reason they waited so long to do that is because they didn't know what a big difference it was going to make. So when people over and over and over say the same thing, which is, why did I wait so long to do this? This is a huge difference. Well, I don't think they're just saying that. It is a huge difference.
Good. Well, thanks for informing us about dentures, implant-supported dentures. Thank you very much, Dr. Leblanc.
All right, Helmut, you're welcome.